Poor old Suter.
What's wrong?
Nothing, I think. Oh, but they keep bothering me.
Wound?
Don't think so.
UTI?
No. Look, you're as bad as they are. The breezes are lovely, thanks. How's the ward?
Sister's really awful today.
Is she?
Yes. We ran out of syringes this morning. She's pathetic. I'm beginning to wonder who organises things when you're both there.
She was up. Mentioned she'd be glad to have me back.
Do you order things, usually?
Often, yeah. Usually.
And who makes up the off-duty?
Me, usually, I suppose.
What does she do when you're on together?
Well, she teaches the juniors.
But you teach the juniors.
Sometimes.
A bright lot up there just now.
Yeah, Sister was full of them. Especially the skinny one with long dark hair, Wallace.
Really?
Yes, they were on late together yesterday.
Really?
Quite a precocious child from the sound of things.
Really?
Thanks for the freezes.
I hope you're all right, son. It's been ages.
I'm doing my best. Things are settling down now. They're starting to talk about convalescence.
Oh, really?
I think I'd rather go home.
The flat?
No. Home.
Biscuit freezer? Oh, thanks awfully, Ronnie. Very good. A good weekend?
I would have been all right, except for wee Karen's teeth.
Oh, I am sorry. Teeth can be such a bother.
How was your weekend?
Well, we ran out. Oh, I should have said, papering the breakfast room with an end lot of biscuit Regency stripe. Awfully nice. Terribly cheap. But we ran out.
I'm terribly sorry. Oh, I'm really sorry, Doctor.
Morning, sister.
Such a squeeze.
Coffee, sister?
Oh, thank you. Thank you.
Sister, we seem to be a bit low on 20 ml syringes.
20 ml syringes?
We haven't got any, but maybe you've ordered some.
Oh, yes, I think so. I hope so. But I just... Let me check. Sorry, Doctor.
Really, David? No wonder she gets upset.
I'm afraid he arrested over the weekend, sir. Sunday evening. No luck with resuscitation.
Dear. And there was that other one of mine, the one I didn't even see, the poor man who arrested on Thursday.
Yes, sir.
Oh, dear. Yes, I wonder what's doing it.
It occurred to me, sir, that it might have something to do with our laxative policy.
Laxative policy?
Yes, sir.
I wasn't even aware that we had one. Of course, that sort of thing's generally left to the nursing staff, but then that might be quite anomalous.
It occurred to me, sir, that these laxatives might cause just enough potassium disturbance to tip off something dangerous in the heart. Perhaps even ventricular fibrillation?
Like cholera. Yes, I remember Highland Light Infantry RSM in Penang.
Yes, sir, like cholera. Perhaps a less drastic shift in potassium, but still fatal for these people with coronaries.
Yeah, I don't remember seeing that in print.
The cholera-potassium thing's well documented, sir.
Yes,
I think I see what he's trying to get at, sir. A purgative-induced potassium shift inducing fatal hyperkalemic arrhythmias after recent coronary thrombosis.
It sounds good, Ronnie, but it won't be all that easy. We'll need total body potassium, sir, so that means getting the isotope people in for balanced studies.
But the point is, sir, that it's an internal shift from blood to gut. Therefore, these balance studies of yours would prove nothing. But I'm sure we can solve it. Half-hourly blood samples, gut samples too. Half-hourly, that is, from long tubes top and bottom, if you follow me. Because we need a picture of potassium shifts in the gut as a whole.
But Ronnie...
So we'd need 25 coronaries getting the usual laxatives and 25 getting none. So, with 100% patient cooperation, I'm sure we could get the whole thing wrapped up in 3 months.
Well, what more proof do you want? I mean, 2 out of 2 is 100%. I take it they both had laxatives.
Don't you think, sir, that multiple blood sampling and tubes in both ends might be a risk to patients who've just had coronaries?
Surely, sir, we have to pinpoint a major cause of death in a common disease.
Yes. Well, maybe. But I have no doubt at all that we must be taking a good look at the way laxatives are being used. I mean, they can't just be handed round like dolly mixtures.
With perhaps fatal results.
I'm afraid Sister isn't feeling quite herself today. Mm-hmm. Yes, sir. Unfortunately, the houseman upset her this morning.
Okay, down to this thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Watch the boxes, that's it. And it's there. It's
I thought I wouldn't go too far with the pot plant, sir, seeing it's an informal occasion.
Quite right, Billy.
It is nice, though. I did think I was going to have difficulty with the transport, so I rang 999, got my brother-in-law to send down an ambulance. I knew the driver, so we picked up the glasses as well.
It's all looking very smart.
Thank you, sir. On duty, I see.
Afraid so.
A half pint, then, just to see the barrel's all right.
Thank you, Billy.
Speak up, please. It's a 20
Oh, thanks, Billy. We the only ones not over at the pub? I'll drink to that. Oh, secretaries from radiology. Ugh. Where do they get them? Ooh. Nope.
Is someone getting you a drink, Mary?
Yes, thanks.
Oh.
And Dr. Campbell.
Yes, Mary?
My name's Jean.
How's the ward?
Fair.
What about that new stroke, Mr. Affleck?
Oh, he's just died.
I'm not surprised. And the ulcer?
He'll live.
Do you have to talk shop? I'm Mrs. Affleck, Doctor.
Simple from Ron Johnstone. And you make me want to real. Intuition album, it's a hip swinger. Wonder what? Take it on, come on, let's see, move yourself.